I think we won't hesitate. My name is Linda Bauman. I'm president of the UNA of Dane County, and we have a regular program calendar. Once a month on a Tuesday, we provide speakers and sessions that address some of the strategic development goals of the World Health Organization and the UN. And one focus that we've had in the last couple of our presentations has been on climate change and global climate issues. And Dr. Lemay is a researcher who's done some work in climate. And if I go back to his title of his talk, he's going to talk about accounting for the healthcare costs of climate change. He's currently a climate and health scientist in the Natural Resources Defense Council, and his work addresses international environmental health challenges with a focus on the public health burdens that this creates. So without further hesitation, I will turn it over to you, Dr. Lemay.
Great, thank you, Linda. Can everybody hear me okay, hopefully?
Yes.
Great, super. It's great to see you, Linda, virtually. It's been a number of years since my time. I did my PhD at UW-Madison, and I really appreciate the warm invitation from all of you to share some of our latest work on climate change and health. So Todd, whenever you're, hopefully it's coming along, whenever you're ready, we can get going with the slides, but I'll just start with a little introduction. As Linda said, I'm a climate and health scientist at the Natural Resources Defense Council, NRDC. We are an international environmental advocacy group, 50 years old, and we work both domestically and internationally to advance environmental and human health protections. Sorry, Todd.
There. Can you see it?
Not on my screen yet, but.
Well, I see it.
Okay.
I can see it too, Todd.
Okay, it says I'm sharing my screen.
Yeah, but you can just go up there where it says slideshow and just show the slideshow. You don't have to show that column on the other side that shows the upcoming slides.
Oh, okay.
Yeah, up at the top here that you have home, you go across here, it says slideshow. Home, insert, draw, design, and then you go over to slideshow.
Okay, gotcha.
On slideshow.
Yeah.
And click on that and see what you get. You should get from the beginning as a choice. And that's what you want, is from the beginning. Over here, go back to.
Okay. Not.
Okay.
There
you go. That's kind of what you want.
Now, how do I go from slide to slide?
You simply click on it and it'll go to the next slide. Isn't that right, Dr. Lemay?
Yeah.
Okay, thanks, Mary.
Okay, thanks.
Yeah, thank you. Yeah, so you can go ahead, Todd, thanks. And I'll just try to steer you through these. And just to note, I've been at NRDC for about 3.5 years. Prior to that, I worked for a number of years at the U.S. Environmental Protection Agency in the regional offices in San Francisco and Chicago, working on implementation of the Clean Air Act. And prior to that, like I mentioned, I completed a PhD at UW-Madison in both the Nelson Institute and the Department of Population Health Sciences. So I did a joint degree studying environmental epidemiology with Dr. Jonathan Patz, one of the pioneers in the field of climate change and health. And so today's talk, I'm going to focus on some of our work at NRDC, but then also zoom out to the big picture and talk about how health is really a central part of the climate challenge and potentially a way out of this huge crisis that we're in now. So Todd, go ahead and advance to that next slide if you can. Right. I'll just let you know a little bit about NRDC. We're now numbering about 700 on our staff. I'm probably most well known for our legal work. During the Trump administration, we filed a legal challenge to their environmental rollbacks on average about every 10 business days. And we were victorious in about 90% of those cases. So you may not have been able to track all of the nefarious environmental rollbacks by the last administration, but rest assured that folks at NRDC and our partner organizations like the Environmental Defense Fund, Sierra Club, and the Union of Concerned Scientists have been fighting the good fight for a number of years to maintain the bedrock environmental and human health protections that are guaranteed to every American through the Clean Air Act and other key laws. We're so grateful for our more than 3 million online activists and members. If any of you are interested in learning more about NRDC membership and kind of keeping in touch with all of our work across the US here, each of our offices depicted in New York, DC, Chicago, Bozeman, Montana, Santa Monica, and San Francisco, as well as an office in Beijing, and soon an office in Delhi, India. Go ahead to the next slide, Todd. So our work on climate change and health at NRDC really focuses on these 4 key areas. The first is just communication about the challenge. It might surprise some of you to know that most people in this country and certainly around the world really aren't fully aware of the tremendous health risks posed by the climate crisis. In recent polling over the last 5 years or so, most Americans are unable to identify even a single health impact from climate change, which is, tells me that we have a lot of work to do just in sort of connecting the basic science to relevant impacts on human lives. So I help out with all of these areas, but focus quite a bit on the research and analysis side, and I'll tell you about some of our latest research today. We also focus on improving climate adaptation planning across US states. Right now, only about 1/3 of the US states actually have health-focused climate change adaptation plans in place. There isn't adequate funding from the Centers for Disease Control and Prevention to really equip states with the tools and staffing that they need to protect people in the face of climate risks. So we're advocating at the federal and state level to enhance funding and support so that communities around this country are prepared for climate harms that the science tells us are on the way. And then we do, of course, quite a bit of advocacy at every level of government to ensure that there's a robust and adequate response to this unprecedented crisis. Please advance the next slide, Todd. So I think, this group is probably well aware, but I just want to make the point that in the middle of the Trump administration, November 2018, there was really a groundbreaking report, which was the latest chapter in a sequence of what are called national climate assessments. These are really important synthesis documents that represent the work of hundreds of US government scientists, people working for years and years to assemble the latest and greatest climate science and figure out what it means for the functioning of our country. A major sort of headline that flowed from that last report in 2018 was that climate change is not some distant abstract threat. Rather, it is something that's here and now. It's growing in its urgency and severity by the day. And certainly the costs of inaction and delay when it comes to appropriate climate policy are being felt right now. If you can advance to the next slide, Todd, this I think is going to be a video. And if you click one more time, it should play. See if we get audio.
It costs a lot more. There are countless economic analyses now that show that it is now cheaper to deal with the crisis of climate than it is to ignore it. We spent $265 billion 2 years ago on three storms, Irma, Harvey, and Maria. Maria destroyed Puerto Rico. Harvey dropped more water on Houston in 5 days than goes over Niagara Falls in a year. And Irma had the first recorded winds at 185 miles an hour for 24 sustained hours. Last year, we had one storm, $55 billion. So we're spending the money, folks. We're just not doing it smart. We're not doing it in the way that would actually sustain us for the long term. So
I just wanted to highlight that, even in the last few weeks, we've seen the highest levels of the federal government really draw attention to the fact But climate change, threatens to disrupt our economy in significant ways if we fail to step up to the challenge. And that's part of why we've seen the president and his team, including Special Envoy Kerry here, really, advance climate ideas and a focus on this challenge in just the first couple of weeks of this new administration. We have, frankly, been delaying federal action for far too long, but that doesn't mean that we haven't been paying the cost for climate harms, which was a point so effectively made by Mr. Kerry here. You can advance to the next slide, Todd.
It costs a lot more.
I think
There we go.
There we go. Okay, so you don't have to take my word for it. The federal government, the folks at the National Oceanic and Atmospheric Administration, NOAA, actually have been tracking the costs of climate and weather disasters to this country for the last 40 years, since 1980. And this is basically a map of the most expensive climate and weather disasters that hit the US last year. So all told, the country suffered what are called $22 billion disasters. So disasters that inflicted damages to property, crops, and infrastructure on the scale of at least $1 billion. So certainly this isn't the full extent of everything that happened in 2020, as we all know. But it's important to note that last year really shattered records. In NOAA's 40 years of record keeping, they had never seen so many climate and weather disasters across the country. There were 22 of them last year, which broke the record of 16 that had happened in both 2011 and 2017. And as a climate and health scientist, I just do want to note that not every disaster depicted on this map is scientifically attributable to climate change. There's mixed evidence on the derecho events that we've seen across the Midwest. Tornadoes are not thought to be linked to climate change at the moment, but a number of these really costly disasters are clearly linked to the climate crisis, including the unprecedented wildfire season out west last fall. I think it's helpful to remember that it was only a couple of months ago when we saw the skies in the Bay Area of California, turned orange for days on end due to wildfire effects. Of course, there's been widespread drought across much of the US in recent years, and we saw an unprecedented hurricane season in the Southeast that really raced through the alphabet at record pace last fall. So all told, these 22 disasters depicted on this map here represent about $95 billion in damage to human property, crops, and infrastructure by NOAA's estimate. NOAA also estimates that somewhere around 225 Americans perished in these significant disaster events last year. And that number really is just the tip of the iceberg in terms of understanding the human toll of climate sensitive events. So that's really been the focus of a lot of my work at NRDC, is to get a better handle on what these costs are in terms of human health from climate change. We know that whether it's wildfires or drought, extreme storms, or the spread of certain types of infectious disease, the climate crisis threatens human health in all sorts of ways, but we really are playing catch up when it comes to the science and trying to add up the dollar figures associated with healthcare costs. If you can advance to the next slide, I'll just show sort of where the trend lines are at. I mentioned last year shattered records, and last year on this sort of trend line from January through December shows you those 22 events, and the red line at the top of the graph, that was 2020. Clearly head and shoulders above a number of recent years in terms of the number of events. The bottom of this slide sort of gives you a sense of where the longer trends are at. Overall, between 1980 and 2020, the average annual disaster cost was somewhere around $45 billion. A reminder that the 2020 cost was $95 billion, so more than double the 40-year average. And the average events per year for the last 40 years was 7. Last year was 22, so that's more than triple the long-term average. So, very clearly, even though this is just, one metric, the impacts of climate sensitive events are growing across the country, no matter which way you slice it. Okay, next slide, please. I mentioned that I completed my doctoral studies with Jonathan Patz here, and he has really been a leader working for more than 20 years and connecting the dots between climate change and health. I always like to show this figure that he published in 1998 in 8th grade, but he was doing work at that point to basically spell out what climate change means in terms of human health. And clearly there's a lot of work to do. Hopefully I can call on some of you to share this knowledge with people in your networks, right? So we know that climate change on the left side of the slide here is associated with really key transformation of the Earth system in terms of temperature rise, of course, sea level rise, but also changes in the hydrologic cycle, expected to be extreme on both ends. So extreme drought and stronger, more severe storms. Those three changes in the geophysical kind of functioning of this planet are driving huge environmental changes across the country and across the world that are depicted in health terms in the middle of this slide. So we're talking about changes in the urban heat island effect, in which paved urban areas experience heightened temperatures. And we have, of course, an increasing urbanized population around the planet. I focus a lot on the issue of climate change and air pollution, because the fossil fuel sources that drive the climate crisis are also contributing to huge morbidity and mortality burden across the country and across the world right now. So those problems are very tightly linked. There's also established links between climate change and the distribution of what are called vector-borne diseases. These are diseases that are transmitted by an intermediate host, in this case, mosquitoes that help to transmit things like malaria and dengue fever, but also waterborne diseases of concern, especially in other parts of the country. Cholera outbreaks have been pretty strongly linked to climate cycles. And we know that there's been huge disruption of the hydrologic cycle that affects the distribution of waterborne diseases, as well as the quantity and quality of the water supply. And an area that's received more attention lately, but still not enough, is the issue of displacement and environmental refugees. If we have unprecedented levels of sea level increase, we basically, render large parts of this planet uninhabitable. Huge populations currently live on the coastlines, and so we are facing a huge challenge when it comes to relocating folks and dealing with geopolitical fallout from all of that. So this is what things have looked like for 20 years or so on the climate and health front. If you can advance to the next slide, I'll just walk you through some of our recent work to try to bring some of that work down to the local level and really frame it in economic terms. So when we think about the climate crisis, we hear a lot about the supposed costs and the sacrifices that we'll have to make in order to respond to this problem, right? We hear rhetoric about, having to give up flying or not eat hamburgers ever again, or, not engage in the activities of daily life that we currently enjoy. And certainly, transitioning our world away from fossil fuels will involve change. But I think, the point of a lot of my work is to demonstrate that the costs of continuing down this path of delay and inaction are tremendous. And you can think of it basically like a climate tax that we're all paying right now. It's a tax that's regressive. Climate costs are basically shouldered by our most vulnerable neighbors. It's random, right? We don't know where climate harms are going to appear from year to year. And it's rising, right? Every year that we fail to act, we see the trend lines unmistakably in one direction of increasing burdens. You can advance to the next slide. I'll talk a little bit about sort of some of the history here. I think I mentioned that it's been historically the pattern. Oops, is it sort of stuck?
It's not advancing.
Okay. Maybe if you escape out of it.
Does it work if you hit the space bar?
Oh,
There we go. Great.
okay.
Thanks for the tip. So, we sort of talked about these health costs as hidden costs because they are a lot harder to track. The US government isn't really tracking them at this point. And we know that they are inflicted on communities that are experiencing a bunch of other burdens. So it's sadly the case that health costs really have not been adequately included in our public understanding of the risks of climate change. It's been, the pattern that we include things in economic assessments that are easy to count, things that are repaired or insured, things that have dollar figures pretty easily attached to them by economists. But there's been much less work in this kind of interdisciplinary space at the nexus of climate change, health, and economics. That's for a number of reasons, including the fact that the number of data sources required to understand the cost of climate change to human health are pretty limited and disparate at this point. But we at NRDC have been trying to get the ball rolling in terms of accounting for these costs by using a case study approach. You can advance to the next slide. I'll talk a little bit about the first study that was published now a decade ago, which was really the first of its kind study led by my colleague at NRDC, Dr. Kim Knowlton, who is another climate and health scientist. Kim and colleagues looked at basically a set of case study events, 6 case studies of climate sensitive exposures across the country depicted on this map here, and did their best to assemble the publicly available health data associated with each of these events, including a heat wave in California and wildfires, flooding in North Dakota, an outbreak of West Nile virus transmitted by mosquitoes in Louisiana, and a hurricane event in Florida, as well as national exposures to smog air pollution. And so, they stitched together the data for those events from 2002 to 2009 and arrived at an approximate price tag of $14 billion in unaccounted for health costs associated with just those 6 events. And we know last year, for example, that there were more than 20 such events across the country. So this was really our first look at the magnitude of climate-related health costs across the country. If you could advance to the next slide. I followed up on Kim's work in 2019. We published a study that's open access, and I'm happy to share these slides with you all after the talk so you can access the link. We employed a similar case study approach, but tried to update the analysis by looking at climate sensitive events across the country in just a single year in 2012. And we focused basically on a similar project of gathering publicly available health data in terms of understanding the number of hospitalizations, emergency room visits, and deaths associated with climate sensitive events, and then connecting that health data to health cost information. I don't have to tell any of you on this call that healthcare in this country is extraordinarily expensive. More than half of US adults report medical financial hardship, which means that they are delaying or completely foregoing needed medical care. We don't really have great accounting for climate change related health costs, but we do have information from the Centers for Medicare and Medicaid, the CDC, other federal databases that can help us sort of connect the dots if we have information on, say, a visit to an emergency room for heat exhaustion, for example. So we employed this, what we call the combined valuation method, to basically get at the more holistic assessment of health costs. So including a whole range of health-related costs associated with both illnesses and deaths related to climate-sensitive events. All right, next slide, please. So I mentioned that we looked at 2012. This animation here depicts each of the case studies that we analyzed in our analysis and in the GeoHealth work. So there has been pretty solid science published by federal scientists, people internationally, in terms of the range of climate-sensitive health outcomes. So following up on that, foundational work by Jonathan Patz and others more than 20 years ago. each of the exposure types depicted on this map is pretty solidly linked to climate sensitivity. And that just means that things like wildfires, heat waves, and extreme precipitation events are worsened by climate change. And they're worsened in any one or a number of ways, including increased frequency, intensity, duration, geographic scope, etc. And so we tried to basically assemble a diverse mix of case study events across the country. Each of these hit the US in 2012. To basically represent the fact that no corner of this country is going to be spared harm when it comes to climate-related risks, and to draw on the wealth of local data that's being collected often by state and local health departments to understand the burden that these events are placing on people and families and communities right now. So this sort of case study set represents the overall scope of our analysis. And I spent the better part of a year and a half, if you can advance to the next slide, collecting data in order to connect the dots between health problems associated with each of those events and each of these costs. So in thinking about health costs, we tried not to just think about the direct cost of care in an emergency room or the impact of a premature death, but also the subsequent costs that people and families are shouldering even after they leave the hospital. So the lost wages that they forego during potentially several days of hospital care, the need for outpatient or home health care after leaving the hospital, as well as prescribed medications, which can, of course, be pretty expensive, especially in the US. So we employed health cost metrics that are used by the federal government already, what's called the value of a statistical life, which is basically a crude way of attaching economic damage to premature mortality, and something that the federal government does all the time in its regulatory impact assessments. I think the next slide will show you the range of health data that we collected. I mentioned the project over about a year and a half to collect data from a number of sources. Right now, we really lack a centralized resource, a database in this country for understanding the impacts of climate change on health, which is why I had to scour each of these sources, peer-reviewed literature, data collected at the state level, as well as information from the federal government across each of these case studies, more than 36 data sources to basically assemble the puzzle pieces and come up with some understanding of the impacts of each of these events across the country. So I'll mention here that if you look way at the bottom of the table, Hurricane Sandy, we actually incorporated about 21 peer-reviewed epidemiology studies. Of course, the scientific enterprise is not that fast. We ended up employing a study published just in 2018 on pregnancy complications caused by Hurricane Sandy. And so, this really shows you that this, as hard as I worked, still represents an incomplete picture of even what happened across these case study events in 2012. All right, the next slide, please. This is a busy figure here just to show you sort of how we try to connect the dots between health data depicted in the yellow boxes, health cost data in the blue boxes, and the green box to arrive at some understanding of total health related costs. We undertook a little bit of what's called data imputation, which is basically a way of filling in the gaps in our data. So if a study, for example, only collected emergency department visits rather than hospitalizations, there are mathematical statistical adjustments to make to account for hospitalizations that we, are pretty, we can expect occurred based on the averages, but we didn't have the directly reported data. I won't linger on this slide because it's giving me a headache, but if anyone wants to talk nitty-gritty on methods, we can do that at the end. All right, next slide, please. So in terms of understanding, specifically what these exposure events mean for human health, I just wanted to draw attention briefly to one of the tables from our paper. This represents, pretty grim accounting of all of the health problems that we uncovered from those 36 data sources. And I think it's not apparent to me as someone who studies this issue all the time that, these problems are widespread. Something like a hurricane now has been linked to disruption in dialysis care, to mental health problems, to pregnancy complications, like I mentioned. And all of this suffering very often is happening under the radar, right? It's happening in the days, weeks, and months subsequent to a disaster event. And it's not making the headlines, but it's nevertheless very real, tangible, profound human suffering that I think we really need to take stock of and do our best to avoid in the future. So this table here represents sort of the scope of the specific health problems classified by what's called the International Classification of Disease that allowed us to connect health problems to health costs. Okay, next slide, please. I did want to highlight a couple of specific health problems. I mentioned the hurricane-related effects, but also we employed pretty groundbreaking analysis and data from the Environmental Protection Agency on the burden of wildfire smoke, which is, of course, an issue that's been receiving increasing attention over the last couple of years, as we've seen historic wildfire damages across the American West. It's not widely appreciated, but wildfire smoke is a huge threat to many people, millions across this country, because it can actually impact an area about 50 times as large as the area actually burned. So that's why here, in Wisconsin or on the East Coast, we can detect the damage of wildfire smoke. We see cloudy skies, and particulate matter is the #1 offender when it comes to deadly air pollution. And so it's really important that we understand that, as much as we can watch the news and see everything happening in California, and, thank goodness we're not right there in harm's way, there are nevertheless downstream health challenges inflicted by wildfire smoke. All right, next slide, please. So here are the key results from our study. So looking across the country, just at this case study set of events, we arrived at some pretty stark numbers. More than 900 deaths associated with these climate-sensitive events, as well as more than 20,000 hospital admissions and 17,000, almost 18,000 actually, emergency department visits. So, these are basically numbers that are not captured in any climate assessment for 2012, but nevertheless represent, detectable human harm inflicted by these events. And like I said, very likely a conservative estimate because we relied only on publicly available data. We were basically at the mercy of whatever research had been done or data had been collected. So that's a pretty stark total. When we connect it on the next slide to health costs, we end up with these numbers here. So about $8.4 billion associated with those more than 900 deaths. Another $1.5 billion or so associated with illness costs. So when you add those two figures up, you end up with about a $10 billion price tag associated with just this, admittedly limited sample of climate-sensitive events across the US in a single year. To give that $10 billion price tag some context, the federal government estimates that all of the climate and weather disaster events in 2012, so excluding health, inflicted about $40 billion damage. So we're basically adding 25% to the national price tag when we consider just this sampling of events. So we, if we zoom out on the next slide, we have reason to believe that these costs are not borne equally by people across this country. We identified the expected payers of that $1.6 billion price tag of illness costs, and we found that a hugely disproportionate share, almost 2/3 of the illness costs, were shouldered by Medicare and Medicaid patients. Of course, those are our most vulnerable groups, the older folks, economically disadvantaged, people that the science tells us are most vulnerable to the adverse health effects of climate change. We also, found evidence to support our understanding that our health systems right now are not equipped to handle the climate emergency. The power went out in a number of hospitals in the New York region during Hurricane Sandy and disrupted dialysis care for a number of patients. And so, we're really encouraging health systems to take a look at this information, to engage in more proactive planning to ensure that their operations can stay afloat during these events. All right, next slide, please. We came up with a number of policy recommendations related to this work. I don't think they'll surprise many of you on this call. First, that we really do need to redouble efforts to reduce climate pollution. Everything we can do to slow this train down will benefit our health. At the same time, we need to enhance our focus and investment in adaptation to address and prepare communities for the climate change related harms that we know are on the way based on what the science says. I won't focus too much on these last two recommendations because I have a couple slides towards the end on them. Next slide, please. So the challenge here is taking that $10 billion price tag from our case study set and really extrapolating. We only looked at a sample of states in a single year, but we know that there are really potentially hundreds of future events we're talking about when we think about wildfires, floods, heat waves, and air pollution episodes. So our challenge here is to extrapolate from these case study approaches to a broader national picture. On the next slide, I'll show you some early work we've been doing to do something like that. The chart here basically depicts our study versus what we know occurred across the country outside the case study set in 2012. And so you can see here, the blue portions of each bar represent the health impacts represented in our study in that $10 billion price tag. This is 5%. The yellow hash pattern represents the share of the national burden that we know occurred based on other data collected by CDC or the states. So you can see that for hurricanes way over on the right, for example, we think we captured well over 90% of the national mortality burden from that event. But for other events like a Lyme disease outbreak in Michigan or the extreme heat episode that we tracked in Wisconsin, we know that we captured less than 5% of the national burden. So if you take the information on this chart and our $10 billion estimate, you end up with nationally somewhere in the hundreds of billions of dollars range for the climate sensitive health costs in 2012. And we're working to refine those estimates and get to a place where we can start to talk nationally about the total price tag here. All right. Next slide, please. And I'll wrap up soon so we have some time for Q&A. I just did want to highlight that, oftentimes climate change is represented as a huge international or national problem, but it's really a local story. So we were heartened by the fact that this study generated quite a bit of local press coverage, including in Wisconsin by Wisconsin Public Radio, showing that climate change, yes, is a national problem, one that our federal leadership needs to address, but it's also something happening at the local level that states and localities, including public health departments, need to be working to respond to. The governor of Oregon, way over on the lower right here, actually reached out to us after our study was published to look into wildfire smoke impacts in her state. So there's certainly appetite for more work in this area. All right, next slide, please. We've been doing quite a bit of blogging. I just wanted to draw your attention to the NRDC site. We try to contextualize what's happening in the news when it comes to climate change and health, and remind people that the cost story is an important one to keep in mind. All right, next slide, please. And I think if you click one more time, we were also encouraged to see in Wisconsin, maybe one more click, please. In December, some of you might have seen that the Governor's Task Force on Climate Change report was published. We took advantage of health data collected by the Wisconsin DHS, Department of Health Services, to conduct our analysis of heat wave impacts in the state. So our research was cited by the Governor's Task Force report in helping to make the case that climate change is a costly problem in terms of health, and that these costs are not, some distant threat in the future, but they're actually weighing down on us now and increasing in their burden. So we're hopeful to see more, attention and sort of the rhetoric around the cost of inaction being too high. Hopefully that will take on an increasing kind of voice in the climate debate in the future. All right, next slide, please. In terms of what to do, we have published some work just recently in December in the health policy journal Health Affairs, basically to draw the healthcare world into the climate issue. This piece that we published in December basically focuses on what ought to be done in order to enable broader assessments like these to happen across the country. You know, it shouldn't just be NRDC conducting a handful of studies on this issue. We really do need to modernize our public health data systems in this country, but also make better investments in climate change and health in state and local health departments in order to advance understanding. So this paper is also open access, and happy to chat about that in the Q&A. All right, next slide, please. You know, when it comes to what ought to be done in terms of a federal response, I mentioned that we, really do need better estimates of the health benefits of a robust response to the climate crisis. So sort of flip the script here, instead of talking about increasing damages from inaction, talk about the health cost savings to American families that can be achieved here and now by climate action. We also, of course, need to invest in staffing and local understanding of climate impacts on health. And lastly, improve our public health surveillance systems. I think, the last year or so, the experience in this country when it comes to the pandemic has really been eye-opening in a number of ways, right? But one of them, for me as a health scientist, is to recognize that our decades of underinvestment in public health have really harmed us, right? CDC is relying on fax machines, something that I haven't myself seen in action in more than 20 years, to share health data with state and local health departments. I mean, it's shameful, frankly, that we are relying on outdated technology when we have, advanced cloud computing, we have fancy Instagram filters, and yet we're relying on technology to share vital public health data, life or death data, with fax machines, recordable DVDs, and emailed spreadsheets. So I think hopefully the experience of the last year, in which we've had, newspapers and magazines take over the role of the CDC in tracking health data, I think this should be a wake-up call for all of us, that we need to bring our federal surveillance systems and our health data systems into 2021. This has been a national embarrassment, and I'm hopeful that as we work to build back better on that front, we will also build in an accounting for climate-related health problems in our tracking system. Sorry, I'll get off my soapbox there, but I just did want to remind folks that we have, really paid the price in terms of a slow and inadequate response, in part because of our inability to understand the data and to share it effectively. All right, next slide, please. I did want to also draw attention to another paper I led in that same special issue on climate change and health affairs. So this is, about 24 pieces that came out that are all publicly available for free. I encourage you to check it out. On this piece, I worked on what can be done in terms of improving K-12 education in this country. Right now, there really isn't systematic teaching of climate change and health. And we came up with this paper, a way to basically break the climate crisis into a digestible, accessible format for students. The next slide depicts our approach to what we're calling climate and health literacy, which is basically a way of breaking down the climate and health relationship into 3 levels, functional, intermediate, and advanced, and basically describing the climate problem as one that has profound implications for human well-being for years and years to come. We hope that this paper will sort of help jumpstart enhanced teaching on climate change and health, and help to set up students for careers responding to this crisis, because one way or another, it's going to define their existence for years to come. All right, next slide, please. Just wanted to mention that there's been a lot of
talking a little bit about the cleimate crisis and its relationship to the.
That's me. Actually, we'll skip this slide.
To reduce air pollution.
My recorded lecture is rearing its head here.
Benefits of those efforts. Basically, the idea that efforts.
Did you want that on?
You know what? I'll just, let's hope that you paused it there. My recorded lecture reared its head here. I just wanted to draw attention to the fact that, when it comes to addressing climate change, there are these multiple benefits, but what are kind of awkwardly called co-benefits, basically accounting for all of the improvements in life here and now, whether it's physical activity from reduced reliance on automobiles, or it's healthier diets from reduced red meat consumption. There's all sorts of reasons to act on climate change beyond trying to improve the situation decades down the line. All right, next slide, please. I'll just draw attention to the fact that we are trying to bring, like I said, medical professionals into the fight and really, advocate that these folks join us in talking about climate change in hospital settings, in the doctor's office, right? Talking about the fact that well-being and health will in many ways be affected by how we as a society respond to this problem. So this is another commentary that I published with colleagues at UW-Madison in the Journal of the American Medical Association about a year ago, trying to draw attention of health professionals to the fact that basically, making the case that climate action saves money and benefits our health. All right, next slide, please. I just want to wrap up with a little bit of optimism. It's hard working on this topic day to day because there is so much scary information in terms of what the science tells us is on the way. But I try to remember that we have been in hard places before. This is a picture of the New York City skyline in 1966, about 4 years before the Clean Air Act was passed. The Clean Air Act turned 50 years old in 2020, and if you click on the next there, the truth is that this has been one of the most impactful laws in this country ever, really. It has, by scientific estimates, delivered about $2 trillion in health benefits, with a compliance cost of about $65 billion over about a 30-year time span. So we're talking about health benefits that really outweigh costs by a factor of more than 30 to 1. That's by the EPA's own estimate. So I think a similar sort of framing, if you go to the next slide, can help to make the case that, if we act on this crisis, if we, no longer delay and stall on this problem, we can save lives, we can save billions of dollars, not just in 1 year, but in years and years and years to come. This is really the moment, right, to step up to this challenge, acknowledge that the science is real, and design our response as a society appropriately. Okay, I think I've got just a couple more slides, but I do want to leave time for Q&A. I wanted to draw your attention to, if you click maybe one time, this is a slide showing the mapping that's on our NRDC site to try to give people a local understanding of climate impacts on health. Try the next slide. We've also been working pretty hard to synthesize the evidence at the state level. This is a number of issue briefs, 7 thus far, that we have been working on to basically bring this problem home, not talk about it as just a national issue, but one that really is in our backyards right now. So I have the link to these state level issue briefs at the bottom of this slide. I think that's almost it. I think my contact info, is on this slide, but I'm happy to open the floor. Sorry, I took so much time. I wanted to leave more time for Q&A, but I really appreciate the invitation and hope this has been an informative set of slides. Thanks.
Well, thank you very much. That was very informative. I'm going to go to the chat, and there was a question here. One question was about oak pollution. What can be done about oak
pollen? Oak
pollen.
Oh, oak pollen. I'm sorry.
Oh, yeah. So we looked at, oak pollen exposures in North Carolina in 2012. And there was actually a new study, the sort of climate pollen health link is receiving greater attention. Some of you might have seen the New York Times story today on some new research in that area. So, in terms of what can be done, actually quite a bit can be done in terms of informing people about health risks, right? We know that pollen seasons are starting earlier, ending later, and are more severe. There seems to be apparently more pollen in the air from specific plants that are stimulated by more CO2 in the atmosphere. But quite a bit can be done in terms of reducing asthma risks, making sure people are aware of pollen-associated health risks, and basically doing that public health risk communication endeavor that isn't always so thoughtfully executed across this country, in large part due to lack of resources. So, it is admittedly a harder problem to manage, but it's one in which we do have, some learnings from public health in terms of risk communication and reducing exposures.
Thank you. Another question on the chat is that you did not mention population growth as part of a recommendation to address environmental change or climate change.
Sure. Yeah. NRDC and I think the larger environmental movement is not about telling people what to do in terms of population growth or not. It's really a distraction from what needs to happen. I think, if we have fewer people relying on the same fossil fuels, we will end up in the same place. It might take a little bit longer to get there, but the destination will be the same. So this is really about transforming our economy for all people so that it doesn't, your access to clean, healthy energy does not depend on where you live. But we do, I think, need to talk more about consumption, right? We know that the highest income brackets are associated with the highest CO2 emissions. And so certainly there's a conversation to be had there, but I'm not going to enter that set of content right now.
Okay. One other question in the chat is, have you done this same analysis in other countries?
We have not. There's been some work in countries in Europe, in France and the UK, for example, that have looked into climate sensitive health costs. Part of the challenge here is the health data issue here, in terms of accessing publicly available data and really doing that work to connect the dots. But increasingly, folks in the United Nations doing, the global synthesis reports, people that I work with in India are interested in this hook for policymakers, basically telling them that when you look at costs and benefits, you really do need to ask what's not included in that math right now and whether health is adequately represented in terms of that math. So I think certainly there's been international interest, but it's still kind of a growing area of exploration.
Okay. Another question was, what does the NDRC office focus on in China?
Oh, sure. Yeah. So we've been incorporated in China for, I want to say, about 20 years. We've been focusing there on accelerating that country's transition away from coal energy. I was reading a study just this morning that was discussing the detectable air pollution improvements that occurred just between 2010 and 2019 in terms of the country's shift away from especially polluting coal. And we've seen China take real leadership on the international climate negotiation front for in a number, last year or two specifically. And we've been advocating for action with our, I think, 40 or so Beijing-based staffers on the climate crisis specifically. We also work pretty actively on biodiversity protections. We have a huge nature program, and some of those folks are in the Beijing office too. Unfortunately, I'm more up to speed with our India work than our China work.
Thank you. Are there any other questions? Would you, those who have a question, could you raise your hand or just ask?
I was interested in your comment about the pandemic maybe being a blessing in a way to push us into spending more money in our public health surveillance systems. Mm-hmm. And I keep hearing now that the pandemic has also helped us perhaps reduce our climate load in terms of climate change, just by people not driving as much. Right. I wonder if we'll remember that lesson as we go forward.
Yeah, it's a good point that I think, we did see some detectable, thanks for the question, drops in air pollution last spring. It was more dramatic in other parts of the world, but unfortunately, we've seen changes in other consumption of durable goods and other things that are, perhaps sort of eating away at that advantage. So yeah, certainly I think it has opened people's eyes to the fact that our energy choices, our consumption choices have real consequences for environmental quality. And yeah, I'm hopeful that this moment in which we've all been kind of stepping away from our routines will represent, a reflective moment in which we choose to do things differently in the future. I think, neglecting public health has had a real cost in this country. And I think all you have to do is look around you. If you're waiting for a vaccine, if you can't understand what's happening in your neck of the woods when it comes to the disease burden, that is all the result of our neglect of public health, and it comes with a cost. So I hope that this will open everyone's eyes, including our policymakers, that investments in public health are hugely cost beneficial.
Thank you. Any other questions or comments? I guess not. I want to thank you for your presentation, and oh, excuse me, what Erin has a question. Oh, she's saying no now.
I thought I was clapping.
Oh, I'm sorry. You probably were, and
I don't know.